This Week with Brandon Artiles.
Good Sunday morning and welcome to another edition of Local 24 This Week. I'm Brandon Artiles. The August recess is in full swing for members of Congress, and with lawmakers in their home districts, they're getting an earful from constituents about what they want done in D.C. And to discuss what's happening, I welcome the representative for Tennessee's 9th Congressional District, Democrat Steve Cohen. Congressman Cohen, thank you for coming back to the program.
You're welcome, Brandon.
Well, we get started here as we take inventory of what we've been seeing in D.C., certainly as you've been home on this stretch. Things with North Korea now seem to be escalating, given not only President Trump's comments about fire and fury, and then maybe even tougher threats, but also North Korea vowing some kind of strike or developing some kind of plan in the U.S. territory of Guam. As you take analysis of this, is this more saber-rattling from the rogue state, or how seriously do you measure this?
I think it's serious because we have two leaders who are not normal leaders and who do act impulsively and who act without considering the ramifications of their actions, and two leaders who are mostly concerned with the preservation of their own power and the wealth and power of their families. So we're in uncharted territories. In the past, I think every president has been concerned about the safety of American servicemen and their dependents, and there are thousands of American servicemen in South Korea and their dependents as well who would be vulnerable if we got into an attack. And if we did, quote unquote, fire and fury, the likes of which have never been seen on this earth, we would know assuredly that we would lose thousands and thousands of lives. Thousands of thousands would be Americans, and whether they be in Guam or South Korea. So that's something that should be a front burner issue, and it doesn't seem to be. The saber rattling doesn't help. Kim Jong-un wants to maintain his power. He doesn't want to have a war. He's developing nuclear ballistic capabilities as a defense mechanism, so he won't end up like Gaddafi or Saddam Hussein. But he has no desire to attack the United States. The United States should be engaging in diplomacy and working as we have with the UN and sanctions, and continue sanctions and try to work with China and Russia. And the saber rattling does no one any good.
Some of Trump's rhetoric, some think it makes them uncomfortable. Marco Rubio, a senator, of course, saying that things that people need to back down. And we take evaluation of what's been going on in previous administrations. It obviously hasn't worked, that type of diplomacy with North Korea. So what is the path forward with trying to actually work diplomatically with North Korea that doesn't seem to want to cooperate?
Well, they also don't want to have a war. So the idea of threatening them with was apparently and obviously nuclear annihilation is not a good idea. And it's not a good idea for anybody to consider that. I mean, that's a last resort. And to throw it out there on the front end is just irresponsible. Because there are lives in the balance, lives of innocent people, Americans, South Koreans, Japanese, and others. North Korea is not a threat to us. Because they have a nuclear weapon, they're not going to use it because they know they would be. Nuclear weapons are a deterrent, and they are a deterrent in dealing with most nations, and they'd be a deterrent with this country, and that's the only reason they're developing their nuclear weapons. China wants to have a buffer state between South Korea and them, so they don't want to see North Korea disappear. They could help with economic sanctions, and I think we had their vote in the UN. But we need to work with China, we need to work with Russia, and we need to, it was Teddy Roosevelt, walk softly and carry a big stick. Teddy Roosevelt was a pretty good president.
We turn our attention to some domestic issues here at play, certainly with the idea. Do you consider it a victory that nothing was done with the repealing and replacing of Obamacare? Is that a Democrat for those that want to preserve Obamacare, or do you think the longer this drags out, the pending situation there, how do you take
well,
that
firstly, Brandon, it's the Affordable Care Act, Patient Protection Act. Obamacare is a tagline that was put on it by the Republicans to tag it with President Obama, who is popular, but is a person who was African American and who a lot of people didn't like because he was African American. And so in some ways, calling it Obamacare was something the Republicans did as a pejorative about race in America. And I think people should refer to it by its appropriate and right name, Affordable Care Act, Patient Protection Act, and not fall into the Republican game of calling it Obamacare, which is like a tar baby. It's a good act that needs improvement, and it can be improved upon. We need to work on the high-risk corridors and see they're funded. We need to have reinsurance programs. We need to have drug prices negotiated as we should have done before, and maybe have importations from Canada. We should have a public option, and eventually we should have a one-payer system. We're the last industrialized country in the world not to have national health care policy. And but for the efforts of President Obama and Speaker Pelosi at the time and other Democrats who voted for and supported the Affordable Care Act, we wouldn't have a national health care policy now. The Republicans would not have been for it. The only reason they're even for a scaled-down policy that would have at first eliminated health care to 24 million Americans and decimated Medicaid was because they knew that it was now part of the American fabric and they couldn't take that away entirely. But they tried, and they tried to do it by giving it tax advantages, which mostly they were doing to the wealthiest Americans. It didn't work. 15% of the American people liked their replace bill. 15%. So they went to the skinny repeal that still put 16 million people out, and they didn't have Murkowski-Collins, and they didn't have McCain. It's a victory for the American people. It's a victory for people who need health insurance, who need subsidies, who need Medicaid. And there's so many people that benefit from the Affordable Care Act. It's not just those people who got subsidies, and there are a lot of those people. It's not just people on Medicaid, where Medicaid was expanded in certain jurisdictions, not Tennessee, where we gave up over $1 billion a year. But it's the fact that you don't have lifetime caps on your insurance, that you don't have yearly caps on your insurance, that pre-existing conditions are covered, that there are conditions concerning maternity, concerning emergency room care that are covered. It was insurance reform on steroids that everybody with insurance gets, and they don't necessarily see it because it wasn't marketed that way. But there's so much good in it. And when they tried to take the essential benefits out in the House, and they did, leave it up to the states, well, in the South, when they leave it up to the states, they're telling poor people, fend for yourself. The South, unfortunately, has a long tradition of not extending voting rights, extending health care, and extending benefits to the least of these.
My conversation with Congressman Steve. The other side of the break, some more issues to get to, including tax reform. Stay with us.